Let's take a further look at the issues surrounding the health management in the country. And I'm now being joined live from our Abuja studios by the President, Nigerian Medical Association, Dr. Osaho Enabulele. I want to thank you so much indeed for joining us here on the News at 10. What impression did you draw from today's event in Abuja in terms of the outlook of the nation's health sector?
Well, first is to say that I am not president of the Nigerian Medical Association.
My apologies.
I was invited here as the past president of the Nigerian Medical Association and the vice president of the Commonwealth Medical Association.
But of course.
My impression about this conference was that it was a very successful opening ceremony, one in which several conversations took place, and of course with very encouraging outputs and outcomes, particularly as it affects the health sector and, of course, healthcare delivery in our country. A lot of statements were made, especially by the heads of the legislative arm of government and even the vice president of the Federal Republic of Nigeria as to their commitment, more than ever before, to give health top priority and put it on the nation's agenda as one of the development indices that will guide the governance of our country. So, particularly the very impressive revelation by the Senate President that the Joint Committee on Appropriation with the National Assembly has agreed, indeed committed to, of course, impute the expected 1%, which at least was provided for in Section 11, subsection 1 of the National Health Act 2014, in the 2018 appropriation. So that to me was a salubrious development and a salubrious development that will have tremendous impact. But again, from my experiences as a people and of course as an organization, I dare say it is not yet uhuru, because again, not until it becomes evident and it becomes very manifest in terms of the executive embracing it and of course allocating those resources, we cannot say it is uhuru yet. And of course, what we have always advocated.
If I could just butt in here, if you could just allow me to just butt in here, as you have submitted here, improvement in the primary healthcare is indeed critical to achieving the much desired transformation, we understand. But how much progress has been made in this regard to this time?
Well, it's very evident that Nigeria, since the Decade of Development Plan, the Water Harkness Plan in 1945 to 1955, up to now, essentially we've still been grappling with the basic issues in healthcare, in terms of primary healthcare, and how to get it really functional. There were some periods in our existence, especially during the Professor Olusegun Oyebanji years, when primary healthcare got some level of support and empowerment and really became very exciting and functional. The story today is not as exciting. And so primary healthcare is still requiring a lot of attention and a lot of investment by government because it remains the cornerstone, especially at this time when the world is about celebrating the Declaration on Primary Care, 40 years into the Declaration of Primary Care, which was done in Alma-Ata in 1978. So primary care is still at a very low ebb, and the current government had actually given a commitment sometime in its current tenure to revitalize the primary care system, recognizing that that level of government and that level of healthcare was very critical towards solving over 70% of the disease burden of this country. Unless and until that is done in terms of the revitalization of the primary care system through investment of resources in that level of care, through investment in health human resource, and of course other fundamental essentials, the primary care system may not get the kind of desired boost that we all expect. Government needs to invest in that to turn around the inverted pyramid in terms of the kind of operations we are seeing now in our healthcare system, where the tertiary healthcare system is now basically seen as a primary care level. So what do you make disease conditions are brought?
What does the NMA strategic plan for 2017-2021 unveiled today aims to achieve, especially when you look at it in terms of having more people having access to primary health care using platforms like the NHIS?
Well, the strategic plan actually is, this is the second strategic plan of the NMA. The NMA actually had the first strategic plan from 2006 to 2010. And so this is an attempt to further improve and dynamically, in fact, to dynamically improve on what we've always done in the past in terms of our commitment to the health of Nigerian citizens. The strategic plan is about addressing all the aspects of healthcare and, of course, ensuring that healthcare delivery is delivered at a very high quality level by impacting on several of the variables that impact on healthcare, by attending to several of the variables that impact on healthcare in terms of the governance system, leadership and governance. The strategic plan talks about the leadership and governance issues, talks about the health human resource development plans, the quality issues in terms of clinical governance, and of course, even the issue of resources, the funding, and of course, the collaborations and stakeholder participation in improving healthcare delivery. So it is an effort to integrate all aspects of healthcare that needs to be attended to by several players in the health system in terms of the critical stakeholders, including the NMA, in terms of their roles in, of course, advocating for healthcare, in terms of delivering healthcare services, quality healthcare services, in terms of advocating to government about their responsibility to healthcare, and of course, also has to do with the roles of governments in, of course, improving healthcare and the role of also the other development partners, particularly in terms of collaboration with the NMA and other organizations towards improving healthcare. So it tries to, of course, attend to all the several aspects of healthcare to bring it to some level of appreciation and, of course, get people to buy into the project to collaboratively advance the frontiers of healthcare in our country. So it's a very fundamental document which gives a guide on how the NMA intends to lead the healthcare system, because again, as physicians and as leaders of the healthcare system, we need to be able to show a direction. And now we have a direction. We have a directional plan, a focus, and a commitment. And so it's about inviting other players to partner with the NMA and other organizations to move the health sector to the next level.
Amos, thank you so much indeed for talking to us. The past president, Nigerian Medical Association, Dr. Osaho Enabulele.